to be either on a trach collar, because we have to humidify it and we have to warm them. The tracheostomy is an artificial airway. It's an incision into the trachea, surgical incision, and there are some instances where you may even be assisting the surgeon when they do that. Sometimes they will bring the surgical equipment right to the intensive care room. If it's difficult to move the patient to the OR, if the patient has some kind of funky disease process going on, that they don't want them in the operating suite, the physician will actually bring the entire operating team to that patient's room at the bedside in critical care and perform that surgical procedure. Keeping in mind that this is a totally sterile procedure. The patient's going to be draped with those blue drapes. They're going to cleanse it with all of that betadine and stuff. Your job, should that occur, is to control the airway. You would be at the head of the bed. The patient would, in all probability, have an ET tube in and be already on the ventilator. So what you would then do, first of all, is you would jack the FiO2 up to 100%, and you would make sure the patient is well suctioned. The thing that you have to be careful of is he's going to have a drape that's covering this patient's entire head and face, that blue sterile drape. You're going to be working underneath that drape. You're not going to have on sterile gloves because you're not going to be part of the sterile activity that's going on. But what I usually do with this, and I can't intubate him, is make sure the trach ties are cut already. I mean, the ET tube is loose already. But you have to make sure that you're maintaining that tube. So you're going to be underneath that drape, holding on to that tube for dear life. Don't squeeze it. You'll cut off the tube. You can't get air.
When you say loose, meaning either untaped?
Untaped, or the ties cut, or the tape off.
Well,
and
not uncuffed, because we're still giving
But it's still cuffed.
It's still cuffed. But you're going to have your syringe attached to the pilot balloon.
Okay.
The physician and as medical, when they do it at Monmouth, they don't even bring a nurse. They bring the OR tech, and it's the OR tech, the surgeon, and you. Sometimes you'll have a resident. So as he's going to be doing the surgical procedure, when he actually opens the area where he can see the ET tube, he will then tell you to deflate the cuff and start to slowly withdraw. And he's actually going to be able to see that as you're pulling it out. And then when he gets to where the end of the ET tube is out of the trachea, then he can insert the tracheostomy tube, and then you can pull it out, and then he's going to suction, and then you're going to put the trach tie on, and immediately either start bagging that patient or attach him to the ventilator.
You don't pull that tube out, right? From reading, you don't pull that out until he's
until he tells you to.
Until he's comfortable.
He's going to tell you that when he's in, and he can tell you can take the tube out.
When you extubate, you actually pull out fast, but in this procedure, you would go out slowly.
In this procedure, you're going to be pulling out slowly because he's looking at that tube come out, and he's got the trachea open, a surgical procedure.
Okay.
When he sees the end of that tube, and he knows that he can get that tracheostomy, then he will tell you to take the tube out, and they will get the tracheostomy tube in. Some physicians will suture it. They'll put a small suture to hold it in place and to keep that closed. Not all of them will do that. And that's something that you have to be very aware of when you do trach care, as to whether or not that is sutured in. When you're doing trach care in like an extended care facility, that's one thing. When you're doing it in critical care, a lot of times these patients have a brand new trach. It's only a matter of days old. And anytime it's like any surgical wound. Okay, if it's very brand new and that tube comes out, that whole natural tendency is to start closing. So it would make it difficult for you to get another one back in. That's why when you're doing trach care, it's vital that you never let go of that trach. If the patient's had the trach in for 6 months, he's probably got a hole in that big and it doesn't matter. But if this is a fairly new trach in the intensive care unit, you're always going to hold on to it while you're doing trach care. That person will probably be on a ventilator. Now keep in mind that if he's on a trach collar, you can take the trach, you can move the trach collar, put it back, make sure he gets oxygen, that's okay. If that patient is on a ventilator, that machine is probably breathing for him. That doesn't mean that he's not going to still need trach care. So you have to make sure that you're still ventilating that patient while you're doing trach care. If he has the older kind of trach in that doesn't use the disposable airways, you will have a special inner cannula. And you can usually tell because the top of it's a different color. Mostly red. I have seen a green one. I don't remember where I saw that one. Usually they're kept at the bedside of your patient who's on the ventilator. If it's not there, they're kept in those medical vending machines, but make sure you get the same size as is on your actual tracheostomy. They come in sizes from like a 00 up to like a 10.
That's non-disposable, right?
This is not disposable.
Oh, no, okay, the ones that lock, and
It
the ones
locks
you
in.
pinch are usually disposable, okay.
Real fast, going back to when you're pulling the ET tube out, you have to deflate the cuff, right? Even when you're
Yeah, the
slowing
doctor
it?
will tell you when
Okay.
to do that.
And
You
they'll
always
tell you to
deflate
deflate the
cuff.
cuff and then slowly pull it out? Okay.
So, this one isn't the right size. But you have to make sure it's the right size so that when you're sticking it back in, you lock it in. There's actually two little blue dots on there, and you want to line those two dots up to make sure that your inner cannula is locked in. Otherwise, the patient can cough and this can go flying across the room. So you want to make sure this is locked in. And this is only if your patient is on a ventilator, because now you can attach him to his ventilator while you're doing cleaning the inner cannula if it's not a it's disposable. Most of the hospitals now, and even the extended care facilities, are going towards the disposable inner cannula because of nosocomial infections. Use once and twice.
I'm confused. They're on a ventilator, and you need to take out the inner cannula. So you
Trach Care.
You have to disconnect them,
Yes.
and then
Hammy, is there a circuit on there?
Yeah.
you're disconnecting them, and you're manually
But couldn't you?
manually ventilating them.
No. Okay, he's on a ventilator. You've got to clean the main cannula. What you're going to do is take that inner cannula out, put this inner cannula in, and now you can still, is this the same size? Is it going to fit? No, it's not going to fit. But now you can pack him back to the ventilator. He can still be on the ventilator while you're doing whatever you're doing.
But don't you have to clean and suction around the site? Like, how are you supposed to do that while, like,
Go ahead.
Because she's saying why you have
I know that there's steps before that where you have to suction and you have to remove the inner cannula and you have to, so you're just replacing the inner cannula, but don't you have to suction in between replacing it? So
Not
they're just going to be off
necessarily.
of.
Not necessarily. If you're doing Trach Care, you're going to take this inner cannula out so you can clean it. It's got mucus and crustiness.
Oh, and then you'll replace it.
Exactly.
Okay, so it's kind of like a temporary
This is very temporary.
cannula.
Right.
That's
so
why it's a different color.
until
And
you
once you finish, you're going to put back in the.
Oh, she's talking about it
So
being
you disconnect.
non-disposable.
You have that right there. You quickly do that temporarily. You clean your either disposable, non-disposable, or you get a new one if it's disposable.
If it's disposable, you get a new one. If it's a non-disposable, you clean it.
So if it's disposable, do you even have to put the temporary in, or no, you just put a new?
If the patient's on a ventilator. If he's not on a ventilator, no.
So you know
Okay.
he's breathing.
What I'm saying is, if he's on this ventilator and you got to take this out, he can't breathe
No, I
because the
know, but I
machine's
mean,
breathing for him.
couldn't you just put, if it's disposable, couldn't you just put the new one in right away?
Well, the disposable ones is different. We're talking about the
Okay, all right,
non-disposable.
we're going to, okay, sorry.
If he's got a non-disposable,
You'll have that.
you have to put the temporary one in when you take the other one out so the patient can still be on the ventilator while you're cleaning
Okay.
the inner cannula.
And it's a very quick thing. Like you're in and out in like 5
Oh,
seconds.
yeah.
You disconnect, stick it in, lock it, connect it. You're done.
And while you're cleaning the other one.
He's got a
Then he's still
temporary.
attached to the ventilator.
Right.
He's still getting breaths.
Would you hyperoxygenate him at all, or no?
You can give him 100%.
And
Just
then
remember, if he's
silence,
on a
or-
ventilator, it's very easy to hit that button and give him 100%.
And silence, or no? The same, because you're going to be
Yeah, you
disconnected.
can hit silence, so it doesn't go beep beep on you every couple of seconds. Kind of like if you were suctioning him.
Mhm.
Everybody with that?
Mhm.
Sure?
Yeah,
Okay.
but we just got confused with disposable ones.
Okay, but this guy has a disposable one in.
Okay.
He's not on a ventilator. He's only on a trach collar, which means you don't need to put in that temporarily because he's breathing on his own. He doesn't have to get attached to a ventilator. So after you have explained to your patient what you're going to do, even if you think he's unconscious or whatever, you're going to explain to him exactly what you're going to do. You want to put his head up. Okay, if it's possible, you want to make sure that you've checked the chart to make sure the patient can have the head of the bed elevated. What kind of patient would you not be able to elevate?
Somebody with intracranial pressure?
Abdominal surgery?
No.
Increase intracranial
Increase
pressure?
in the cranial pressures.
Hypotensive.
Huh?
Marked hypotensiveness.
Hypotensive. marked hypotensive. How about patients who had spinal surgery? Do you want to actually move, huh?
Yeah, like a neck fracture?
Neck fracture. Yeah. So always look at the chart before you start moving these people around in bed.
You said spinal injury and then ICP, right?
Mm-hmm.
He's on an aerosol bottle. I can hyperoxygenate him simply by turning this little blue thing up to 100%. I'll make sure he's getting a lot of oxygen while I'm doing this. If I think the first thing I'm going to do now is suction him out, because you don't want a lot of mucus while you're manipulating the trach. Now, you're going to have Trach Care kits. You each have one in your box. There are different versions. This one I kind of like. Actually, I kind of like the ones we use at Monmouth, but
Yeah.
Now, yeah, when you suction him, it would be sterile, right?
oh yeah.
Because, okay, it's not clean sterile, right? 'Cause
Well,
you're
the
going-
same when you did
Yeah,
suction.
yeah, I'm
that's-
just making sure.
Yeah,
Okay.
yeah. Okay. You notice that you have a second little container in here. Now, what I do when I'm in the real world, as Carol hates it when you say that, the real world, is I take another sterile drape in the room with me. The sterile drape is usually in those medical vending machines, and it just says sterile drape. It's like a sterile towel. It's wrapped in a separate little package.
Are the gloves, when we put the gloves on for our checkoff, do we have to do those under
This was
sterile?
not sterile. This was just regular gloves.
That's what I'm saying in the kit, so it's not like with the old suction kits where we had to do
Yes.
like the
Sterile
full
procedure.
sterile procedure
Yes,
and put on gloves,
yes.
so this isn't.
This is.
It is,
This
okay.
is. I'm putting this on because I'm going to be playing around up here. Okay, making sure that he's suction, checking my cuff pressure, making sure I'm on 100%. And anytime I think there's a lot of mucus and crap here, I'm going to put on a regular. This is just a non-sterile pair of gloves. You can put your sterile on over your your sterile on over your non-sterile, or you can take these off and then put your non-sterile on. I don't care which way you do that. Whichever way you're comfortable.